Hello and welcome to Conspiracy Boulder.
You're not a boulder, you're a rock!
Welcome to Conspiracy Boulder News. Today we speak about the leading causes of death in these United States. You are in for a surprise. According to the U.S. Government Centers for Disease Control statistics, the number one cause of death in the United States was heart disease, killing 611,105 in 2013 alone. The number two cause was cancer, killing 584,881. No surprises yet. But according to the Journal of Patient Safety, preventable medical errors caused 440,000 deaths.
What is not widely known, and in fact what the function of this hearing is about, and I hope to do my best with the help of my fellow senators and members of this panel, is to start focusing attention on the third leading cause of death in the United States of America. And that will come as a great surprise to most people. And the third leading cause of death in this country has to do with preventable medical errors in hospitals.
So the third leading cause of death today, in the United States, is preventable medical errors. That's more than 1,000 preventable deaths a day, due to medical mistakes. Let's listen to some experts testify before Congress.
Speak today on behalf of hundreds of thousands of Americans whose voices have been silenced forever by preventable adverse medical events.
We need to say, first, that harm is preventable and not tolerable. That science, patient safety is a science, and science must guide it.
A recent article published in the Journal of Patient Safety estimates that as many as 440,000 people a year may die from preventable medical errors in hospitals. 440,000 a year, could be more than 1,000 a day.
Oh my God. More deaths every 3 days than deaths from the 9/11 terror attack. 1,000 people dead daily from preventable medical errors. Isn't that an act of terror repeated daily, day after day? Why isn't this front page news? I mean really. Let's move on. The next three leading causes of death are lung diseases, accidents, and strokes. Then comes the seventh biggest cause of death in the US, which is from the adverse side effects a person has to pharmaceutical drugs that were prescribed to them by a doctor. According to the US government, FDA, Federal Adverse Events Reporting System, in 2013, 1,178,306 cases of adverse reactions were reported, and 117,752 people died from adverse drug side effects. In 1 year. And not a word from the old-fashioned media. Good God. Another 322 dead people a day. Even crazed mass shooters in urban plazas couldn't crank out such horrific numbers. And the old-fashioned media is silent. Not a word. Anyway, then the US government reported that a total of 711,232 people suffered serious outcomes including death, life-threatening disability, congenital anomaly and/or other serious outcomes from pharmaceutical drugs adversely affecting them. Think about it. This is not a joke, over 700,000 people in 1 year. Here's what I find suspicious about the lack of coverage from the old-fashioned media. The old-fashioned media enriches themselves to the tune of billions and billions and billions of dollars in advertising dollars from big pharmaceuticals annually, and ignores adverse drug-related deaths. Is it cause and effect? I wonder. Think about it. There's more. According to an expert that testified before Congress, there are another 10,000 people each day that suffer serious complications from medical errors.
While the subcommittee is to be commended for tackling this challenging issue, I believe that the title understates the problem. We are not only dealing with 1,000 preventable deaths a day, but 1,000 preventable deaths and 10,000 preventable serious complications a day.
Did you hear that? It's not bad enough that more than 1,000 people each day die as a result of preventable medical errors. Now another 10,000 suffer serious complications daily. Where is the old-fashioned media? Boosting their ratings with useless stories full of slanted stupidity. Are they looking the other way to protect their lucrative advertising revenue? I wonder. The Centers for Disease Control stated a few years ago that 1 in 25 hospital patients gets an infection from being in the hospital. Of those people, 700,000 of them will get sick as a result, and a mind-blowing 75,000 die. So another 205 people drop dead, daily, from infections they got at hospitals.
The question is this: can you help us understand why certain healthcare entities have not yet adopted straightforward, proven techniques to reduce these infections?
If you have a culture in your organization where people are afraid to speak up and talk about errors, you're not going to get very far on any of these issues.
The fundamental question is, if I walk into an American hospital today, am I demonstrably, clearly safer than I would have been 15 years ago? The unfortunate answer is no.
Oh my God. Why isn't the old-fashioned media covering this? Who cares what celebrity got what celebrity pregnant? Who cares who dumped whom? What does it matter when real lives are being destroyed daily on an unimaginable scale by the medical and healthcare industry? And your old-fashioned media is ignoring it. Think about it. They'll rush to cover almost any tragic accident or shooting, but will turn a blind eye to more than 1,000 people dying each day. Think about it. No, really. Think about it. And share this video with everyone you care about. Get the conversation going. Start asking questions.
Many of us, myself included, have seen folks go into a hospital for one problem or another and end up coming out a lot sicker than when they went in, and in some cases, dying as a result. How come this story is not on the front pages of the papers every single day? How come this story is not on the front pages of the papers every single day? How come this story is not on the front pages of the papers every single day? How come this story is not on the front pages of the papers every single day? How come this story is not on the front pages of the papers every single day?
Conspiracy Boulder will return after this break.